Now, the second question in women's mental health is which anti-epileptics are preferred in pregnancy? And for this, again, I will use the same Journal of Clinical Psychiatry. This was actually by Dr. Chittaranjan Andrade. So what he did was he actually reviewed findings of these two, like there was one study, one large multinational registry, and then there was a large multinational population-based study and a large meta-analysis on this topic. So he reviewed that and gave his finding accordingly. I'll not go into the study. What were the clinical points? Number one is MCM. MCM stands for major congenital malformation here. So first is we need to know if a woman who has epilepsy, do their risk of major congenital malformation rate changes? Let's see. First is women without epilepsy. The rates are between 2 to 3% for major congenital malformation. Now, for a woman with epilepsy who is not exposed to antiepileptic, AEDs, antiepileptic drugs during pregnancy, the risk rate is similar, right? 2 to 3% here. Now, let's see if that changes with our antiepileptics. First is the levetiracetam, Keppra, and Lamotrigine, Lamictal. You see how the numbers are very similar, 2.6 to 3.5, the mean of 3 here, very close to these percentage. So good data for these two medications. Now, carbamazepine is a little bit higher, 4 to 5%. Oxcarbazepine is between 3 to 4.8%, little bit on a higher side again. Topiramate, this was really interesting, right? Topiramate, 4%. We need to educate our patients because we use it for many other purposes in our practice. Phenytoin, 5 to 7. Phenobarb, 6 to 9. And highest is Valproate. Now, this is really important for our clinical practice because in psychiatry, we use Valproate a lot. We use topiramate, we use oxcarbazepine, we use carbamazepine, we use lamotrigine. So keep this in mind. This is the highest, red, red, red. These one definitely on a higher side. So the other thing the article recommend is risk is dose dependent for 3 medication. Number 1 is Valproate, very well known. And this said the risk can be as high as 25%. Compare how it was 3%, now it's 25% when the dose crosses 1,450 milligram per day. And then for phenobarbital, same dose dependent, and carbamazepine. So be mindful of Valproate and carbamazepine for psychiatric practice. Now, in the end, they recommended consider monotherapy. And in monotherapy, you choose these 2 options, Lamotrigine or Keppra, levetiracetam. I will say we focus on Lamotrigine for our practice. Now, let me go back a little bit, but very briefly, you will see when a patient is seeing a neurology, they will be on Keppra. Keppra, very good medicine, but also carry risk of those neuropsych side effects. So be very mindful of that when you see patients with epilepsy. Now, strongly discourage older antiepileptics, especially phenytoin, phenobarb, and especially Valproate. We already know about this, but I think this was such a good summary, I thought let's include it.